Gum recession treatment, as far as what we would do within the office, is the very first thing I'm going to do is go after the cause of it. What is causing those gums to recede? There's usually a couple things. One is the one that you've heard the most is, oh, you're brushing too hard, you're creating toothbrush abrasion. That does happen. I think that one's blamed a lot more than it really is for the reasons. The truth of the matter is why most gums tend to recede is one, it's either a disease process where the patient has allowed the accumulation of plaque and tartar to build up on the teeth. That's bacteria. When that bacteria gives off toxins, it causes the gums to respond by becoming inflamed, which you heard called gingivitis, and then that progresses into the next steps of further deterioration. And what we'll do is we'll go in and treat the gum disease, educate that patient, and get them into a program that is able to control that gum disease in the future. The other thing that tends to cause gum recession is, and this is a big one, I think this is probably one of the biggest, is when teeth hit wrong. And when you sit there and you just pound on a tooth all day long because it's just not quite in place, that would be simple. That would be the same analogy as if you had like a steel fence post and you set it in concrete, and then you take a hammer and you beat on top of that fence post. You're not necessarily hurting that fence post, but what happens is that concrete breaks down. Well, in this case, if you're hitting real hard on a tooth, what happens is the bone takes that stress and pulls away from it, and when it does, the gums follow it. So usually recession is related to either a gum disease process going on, a tooth hitting too hard, or toothbrush abrasion.